Cancer is not a death sentence. It is a major inconvenience. That's all it is. It's a pain in the butt. Doctor tells you got cancer. It's no big deal. You're not going to die. The only way you're going to die if you get harsh chemical treatments. You got to get rid of that anger, because that anger makes you acidic, and acid feeds the cancer. My name is Dr. Bernardo. I'm a naturopath. I've been in medicine for 60 years. The last 40 years I've devoted to stage 4 cancer, primarily because my doctor friend said there was no cure for cancer. My practice on cancer is based on the work of Dr. Otto Warburg, a German scientist who was brilliant and proved after several thousand experiments that the only cause of cancer was a 35% hypoxia. That means a 35% drop in oxygen in the body. Now, women that get breast cancer because most of them are angry at men. It has nothing to do with genetics. It's got nothing to do with chemicals. It has to do with internal anger or a strong negative emotion. What we have to do is make them aware that cancer is not a death sentence. The death sentence normally comes from some of the treatments that are currently available. In the future, 30, 40 years from now, this will be known as the dark ages of medicine. The body will heal itself. As Dr. Otto Warburg proved, the only cause of cancer is a 35% drop in oxygen called hypoxia. It's this hypoxia that causes cancer to become active. Now, where do we get cancer? Cancer is carried in the sperm. When the sperm fertilizes the egg, the job of the cancer is to fertilize the egg. The egg will divide and multiply till you get an embryo or a fetus. That's the only job of cancer. After that, cancer is just another harmless parasite in the body. Later in life, when people become acidic and the oxygen drops by 35%, and this can be due to strong negative emotions. Pancreatic cancer has always been my experience, is due to a lot of anger. Breast cancer, as I said, is due to internal anger, mostly at men. This causes the body to become acidic. The cancer patient pH will be anywhere from 5.5 to maybe 5. At 4.5, the cancer patient will die because his body is in acidosis. Like, you can remove all the tumors you want, you can do all the surgeries you want, but you have not corrected the condition. The condition is acidosis. You take your saliva pH, put a piece of pH paper on top of your tongue, suck it for 5 to 10 seconds, take it out and compare it to the chart. And what happens? It's yellow. That means your body is in acidosis. We have to raise the pH. When cancer patients go see their doctor says, well, you've got cancer, we got to do surgery right away, we got to remove the tumors. Removing the tumors does not get rid of the cancer. The cancer is in the blood. On the pinhead, you can park 50,000 cancer bacteria. You've got about a gallon of blood. How much cancer bacteria do you have? Okay? You have to get rid of the acidosis. I don't care how many operations you have, how many margins they've cleared, you still have cancer because it's in the blood. And you can prove this by checking your saliva on a daily basis. When people come to me, their pH is 5, 5.5, and I stress to them, we have to raise the pH. And the way we do that is by giving them green juices, asparagus juice, wheatgrass juice, vegetable juice made out of certain vegetables. The cancer patient cannot have any fruit, with the exception of berries, Granny Smith apple, a little bit of pineapple, and grapefruit. We recommend giving the patients antioxidants, mushrooms, teas to raise the pH, teas to help reduce the cancer concentration, and pills to raise the killer cells, T lymphocytes, and the rest of the immune system. You have to build up your immune system to get well. You have to get rid of the acidosis. That is primary consideration. If you get rid of the acidosis, your pH will go up 7.2, 7.4. You keep it there 3 to 4 months, and believe it or not, in most cases, the patient is in remission. Doctors have said when the patient got well and went in remission, well, I have to admit I had nothing to do in putting you in remission. You did it yourself with whatever program you went on. I don't want to know what the program was, but you were successful in getting rid of the cancer. When most patients hear the word, you go to the physician and say, well, my dear, you got cancer, you got breast cancer, we got to remove your breast right away. Negative. Don't listen to that. Get 2 or 3 opinions. I've had many women come to me with all sizes of tumors, as small as a pea to as big as a small lemon or a peach. They did not have to have their breast removed. You have to get rid of the acidosis, as I said. Do not be afraid when they say, well, you got cancer, we got to have surgery right away, we got to do a hysterectomy, or we got to remove both of your breasts. I tell patients, get a second opinion. And I advise that they go to a woman doctor. Most women doctors have a little more sympathy than men. Unfortunately, most physicians, and I'm talking almost 80%, in my experience in 60 years in medicine, that most doctors are in it for money. That's about 80% of the physicians. It's sad but true. The pharmaceutical companies, they want you to use drugs. I have never used a prescription drug in my life. And I will be happy to teach anybody my program, and they can see that their body will heal itself. When you have a broken arm, the body heals itself. When you burn your skin, the body heals itself. God made it possible for the body to heal itself. But why do you have cancer? You're in acidosis. I've had people that come in, they've had 6 operations. When the doctor goes, well, if I do one more, the patient will be in remission. Nonsense. You cannot go in remission unless you get rid of the acidosis. Dr. Otto Warburg proved this. He spent his entire lifetime, was awarded 2 Nobel Prizes. So this is what we do. We take the patient, stay home. Take your teas, take your supplements, take your antioxidants. Go to your doctor. Get to one of the younger doctors, because the older doctors have a closed mind. Their opinion, only chemo, radiation, surgery will save you. It's not going to save you. Might prolong your life, but it's going to be a miserable life. Look at all the cancer wards where the people have radiation and chemo. Look like a death camp, for God's sakes. So don't be afraid when they tell you, well, you got cancer, we got to have surgery right away, blah, blah, blah. I've had women come in here, we got to do hysterectomy right away, right away. And I said, let me look at the pathology report. What's it say? Abnormal cells. Abnormal cells means nothing. Probably 60, 70% of women have normal cells. It's lack of selenium, lack of zinc, lack of vitamin C, lack of vitamin E. Just the pure antioxidants. If you eat more vegetables, more fresh juices, your body will repair itself.